booklet DVD, call 212-CHOICES, 212-CHOICES for a fresh second opinion. Most insurances, Medicare, Medicaid accepted. Not only super convenient, super Broadway and 38th in Manhattan. To hit your cancer, see Dr. Lederman, 212-CHOICES, 212-CHOICES.
With Dr. Lederman, the best prostate cancer treatment is custom tailored for you. Each man with prostate cancer is unique and seeks the best results based on PSA, Gleason score, and stage. That's why Dr. Lederman's custom-tailored prostate cancer treatment is most logical. Not every man should get the same treatment. Dr. Lederman's custom prostate cancer treatment is all outpatient. Our goals are your best results, avoiding radical surgery, maintaining your sexual and urinary function, and your life. Most insurances, Medicare, Medicaid, accepted. Call Dr. Lederman at 212-CHOICES, 212-CHOICES for a fresh second opinion and free booklet DVD. Not only super convenient, super in Manhattan, 38th and Broadway. To hit the cancer, call Dr. Lederman, 212-CHOICES. Cherish your life. Custom prostate cancer treatment with Dr. Lederman, 212-CHOICES.
Welcome back to the Radiosurgery Hour. This is Rob Redstone here with Dr. Gil Lederman at the WOR Studios in the heart of New York City. We're just a few steps from the Radiosurgery New York Cancer Treatment Center on Broadway and 38th Street. Dr. Lederman, the leading cancer expert, treats prostate cancer non-invasively. He was the first in New York with fractionated brain radiosurgery, and he's the first in America and in the Western Hemisphere with body radiosurgery. You can also call Dr. Lederman at 212-CHOICES for a free informative booklet and DVD. Hey, Dr. Lederman, we're back.
Hi, we're back. This is Gil Lederman. We're live and clearing our throats here on WOR. So an interesting man, 73 years old, from Colombia, South America, who came in. He's been going to two of the biggest hospitals in New York. He has thyroid nodules, number one. Number two, he has one hospital looked inside his throat and told him he had cancer of the vocal cord. And he went to the other hospital, and they told him his vocal cords were fine. And then he came to us with a mass in his breast. So three unique problems, thyroid nodules. One hospital saying he has a mass in the vocal cords, one saying it's normal. And he has a mass in his breast under the nipple. And he came to us to sort out what's right and what's wrong. He doesn't believe that one hospital would say he has a cancer of the vocal cords and one says they're perfectly normal. So we're sorting it all out. We sent him for analysis of the breast, and we are going to sort out the vocal cords and the thyroid and report back to him after getting all these records from two different facilities, and we're getting an ultrasound and, if necessary, a little needle biopsy of the breast lesion so that we can put his fears at rest. And with another woman, interesting, 64-year-old woman, single with no children, who had lumpectomy and radiation in her breast at one of the big hospitals in Manhattan, 2011. She had mammograms and then lumpectomy and radiation at this big hospital, and this summer in July she felt a lump in that same breast. Well, patients usually know their body better than anyone else. You live with your body all your life. It follows you around wherever you go. So she called her doctors at this big hospital, and it's a very big hospital, and she said she's got a lump in the breast. What should she do? And what did they tell her, according to her, and I believe her? They said, well, you got an appointment for February 2015. Let us see you in February 2015. We'll check it out. So she's being told by her doctors at this big place to wait from July, August, September, October, November, December, January, February 2015 to evaluate this mass in the breast. She thought it was ludicrous. I did too. I examined her. Yeah, she did have a lump in the breast, and we're getting her worked up. I mean, my God, she had breast cancer, so she's at high risk. She has a lump in the breast, and they're telling her to wait till 2015. Wow. And with another woman who came in, actually her son and husband came in, 68-year-old woman with glioblastoma, a brain tumor, one of the most aggressive brain tumors. She also has meningioma in the past. She had breast cancer in the past. She had a squamous cancer in the past. So in February 2013, at a big hospital, she had treatment for glioblastoma. She had radiation and Temodar treatment. Within a relatively short period of time, the cancer came back. She went elsewhere to a proton beam facility that gave her half the treatment. Now, if she had the full course of treatment, which didn't work, how beneficial do you think half a treatment would be? Yeah, you're right. It doesn't make sense. If the full treatment didn't work, half the treatment's not going to even be that effective, so it doesn't make sense. I explained to them that, from my point of view, it's not logical. If you have 10 punches, it doesn't punch out the tumor. 5 more punches in your, I don't know what, in your nose is not going to punch out the tumor. She had chemo before. Then they gave her half the dose of chemo. They're giving her half of everything. So they're doing something, but they're doing something that doesn't make much sense. The beautiful thing about radiosurgery compared to standard radiation is it's fewer treatments, but each treatment is more intense. And so the radiobiology is totally different when you give a very big treatment, more directed at the cancer, than standard doses, low doses, to a larger area. So that's the difference of radiobiology, and we have plenty of data showing the benefit of radiosurgery for even recurrent glioblastomas, and we treat many brain tumors like glioblastomas and metastasis, chordomas. We treat benign tumors also, meningiomas, acoustic neuromas, pituitary tumors. But the treatment should make sense, and there should be data, and if you had full course of radiation elsewhere, to give her half a dose of proton doesn't make sense. Proton is not that special, and if you come in to see us, we'll give you data looking at our treatment versus proton, and you'll see superior results with us. Cost less, easier to get, and better for the patient. And we had another woman, interesting, who came in for breast cancer. Now, she heard the program. She had a lump in the breast. We found that she had a cancer. We got her staged up. We found that she had a separate rectal cancer. So the fact she was listening to us on the radio and she came in allowed us to work up her breast cancer to see exactly where it was. And we found, not expecting it, a rectal cancer. Now, she had some anemia, and it may be that her anemia is caused by this rectal cancer. So she has 2 potentially curable cancer, an early cancer in the breast, biopsy positive, and a PET scan positive mass in the rectum. Unrelated, separate, looks like 2 separate cancers. She's about 85 years old. She's in great shape. She came with her loving family, and most likely she can be successfully treated for both. So it's up to her now. She's got all the data, and she will take action based upon what she feels is the best approach for her. We have another gentleman who came in, very distinguished scientific man, who has a sarcoma of the tibia, of the shin bone. Now, it presented with a mass, and he had been told by multiple people it was nothing, and by the time he was diagnosed, it had spread to the lungs, like a lot of sarcomas. Sarcomas seem to favor the lungs. He's been on chemotherapy. Well, his chemotherapy doctors want to keep on giving him chemo, and I understand that they want to do that, but is that the best for the patient? Because eventually the sarcoma will become resistant. He already has a big hole in the tibia, the leg bone, and when the cancer becomes resistant, it's going to grow right through the tibia and break it and probably cause him to be severely incapacitated. His doctors told him, don't get radiosurgery, it's going to interfere with your blood counts. Wrong. Radiosurgery just hits the cancer. We don't hit the bone marrow. They're thinking about standard radiation, maybe that they're most familiar with. That's not what we do at Radiosurgery New York. We believe we should hit the cancer, not the healthy tissues. So for him, with sarcoma, even sarcoma, which was thought by others to be radioresistant, most likely if we attack the cancer in the leg bone, we can stop the cancer, shrink the cancer, and allow the bone to heal, so he won't have a broken leg and he won't most likely be incapacitated. It's 5 treatments. Does not affect if he wants to stay on the chemo. He can stay on the chemo, but most likely will give him effective treatment for that leg so that the leg most likely won't break. You won't have to have other surgeries or other procedures, or you won't be walking around in a crutch or a wheelchair if his leg breaks. So this is Dr. Lederman at Radiosurgery New York. We're just about at the end of the hour. Luckily, we have another show later today. We have shows at WOR 4 times on Sunday at 1:30 a.m., 3 a.m., 6 a.m., and 9 p.m. tonight. So if you have other medical questions, please feel free to call me at 212-CHOICES. You can call anytime you want, 212-246-4237. If you want the booklet and DVD about our work, just call us during the work week at that same number, and we'll send it to you. Thank you for listening. I hope you have a great day. I hope you learned a lot today, and thank you very much. God bless you, and talk soon. Bye-bye.
Thanks for tuning in to the Radiosurgery Hour with Dr. Gil Lederman and myself. If you have questions before next week's show or want a free informative booklet and DVD, just contact Dr. Lederman at 212-CHOICES. That's 212-246-4237. That's 212-246-4237. Till next week.
For cancer treatment, most prefer effective, non-invasive, well-tolerated outpatient therapy. That's Dr. Lederman, the radiosurgery pioneer's goal, too. Dr. Lederman is first in America, first in New York, first for you with body radiosurgery. Dr. Lederman hits your cancer with no cutting, no bleeding. Dr. Lederman has decades of experience with primary and metastatic large or small cancers from head to toe. Cancer treatment with possibly a second chance for you, even if chemo, radiation, or surgery didn't work or isn't tolerated. Goals are best results and quality of life. Meet Dr. Lederman to hit the cancer. For a free booklet DVD, call 212-CHOICES, 212-CHOICES for a fresh second opinion. Most insurances, Medicare, Medicaid accepted. Not only super convenient, super. Broadway and 38th in Manhattan. To hit your cancer, see Dr. Lederman, 212-CHOICES, 212-CHOICES.
You've been listening to a podcast from News Talk Radio 710 WOR. 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 WOR.